Hello. So this time of year, particularly in Western Europe and the UK, and indeed in other countries, when winter approaches, inflammatory, scaly, itchy skin conditions such as eczema, otherwise known as atopic dermatitis, psoriasis, seborrheic dermatitis, these tend to flare up. It's a combination of the cold weather along with central heating that we use in many countries, just dries out the skin more and causes this flare up. So if we can preempt this situation and get in there early with the right strategies, you should hopefully find that either you don't get the flare-ups you normally get at this time of year, or indeed the flare-up isn't as severe and you can get on top of it a lot sooner. So the most important thing, which I'm sure most of you sufferers will have heard about, is to hydrate the skin. But there's a few things around that which I still find patients aren't aware of, so I thought I'd just explore that a little bit more today. First of all, you can see your GP or go to your pharmacy and get advice on the best emollients to use. There's a few considerations when you're making your emollient choice. You need to think about where you need to apply it. For example, if you have hand dermatitis and you're using a very oil-rich moisturizer, then actually you're going to have quite slippery hands and you may not actually be able to fulfill the functions you need to on a day-to-day basis. So certain areas may need one type of emollient, whereas another area may need another type. But the important thing is that these moisturizers or emollients that you use fulfill the function they're meant to. And many creams out there which are marketed for dry skin or extra dry skin actually can have a drying effect in the process and are probably better used just as soap alternatives. And there's a few very well-known brands out there that I think actually most dermatologists who I've worked with would agree are not best for moisturising the skin. But I don't want to bring brand names into this video today. It's just really something you need to get good advice on or do your research on. I wanted to talk about how to use a moisturiser when you rub it in. Now, when your skin's inflamed, you need to treat it like a newborn baby's skin. So you need to be very gentle with it and nurture it really. And if you start rubbing like this, you're just going to inflame the skin. Just try it for a few seconds and you'll find that you generate quite a lot of heat. And heat means inflammation, which just means that your itching is worse and your condition is going to be worse. So when you're rubbing in moisturiser, just do it nice and gently in one direction. There's another reason for doing it in one direction, particularly if you're a bit hairy like me, on the arm for example. So let me just show you. I'm going to just take a little bit of this moisturiser. You normally use a lot more than this. And my hair growth is going in this direction, from here down to here. So that is the direction I want to apply the cream in. If I go the other way, I'm much more likely to block my hair follicles with the moisturiser, and you can then trigger something called folliculitis, which is an infection of the hair follicle. And those who use a lot of emollients, particularly the oil-rich ones in hairy areas, will, I'm sure, recall that at some point they've had an infected hair follicle, and that's the reason. So you can try and reduce the risk of getting this by just going in the direction of the hair. And remember, one direction. It takes a little longer to rub it all in, but it's going to be much better for you and much kinder to your skin as well. And the other important thing with hydration is do it as often as you can. For those of you who are working, it can be sometimes difficult, but you really need to get multiple bottles. Have one at work, one maybe in your car, one in your handbag perhaps, or man bag, one at home, maybe in the bathroom, maybe in your bedroom. If you've got it accessible to you, then you're much more likely to do it. And a lot of my patients, want to use it more, but when you actually ask them and they're honest with themselves, they say, well, actually I only used it once today or twice yesterday. So 3-4 times a day, and use much more. As I've said before, 9 out of 10 eczema sufferers underuse emollient. And if you're in the UK and you're paying prescriptions, then you can get these emollients on prescription, and it's often best to get a prepayment certificate, and then you can get as much as you need without having to pay for each quantity that you get, and it can work out more cost effective for you. Okay, keep looking out for our videos. There's going to be more on eczema and on dry conditions in general to try and prevent those flare-ups this winter. Thank you.